All right, so let's see here. You ready to see your smile?
Yeah.
Are you a little bit nervous?
No.
Good.
Everybody told me how good it looks. So.
Awesome. Let's do this. Let's try to come from here so we can kind of capture the prettier part here. Now come this way for this part, first portion. Christina.
Yes.
Okay. Okay. Let's get both of them here. All right, so I'll set you up here a little closer. Go ahead and show your wife her smile for the first time. Smile big.
You look good. You look really good, yeah. Did you see him yet?
Nope, he hasn't. Go ahead and put your mask back on. Okay, I'm gonna turn you around here. Okay, we'll sit you a little closer. So you can say goodbye to this one here in just a few seconds. Okay, go ahead and get zoomed up there a little bit. Ready? Okay, go ahead and take it off.
Holy cow. It's crazy.
You like them?
So good.
Good. I think they look really good.
That's way different. Yeah, that's crazy.
So much of your life you kind of hid that, right? Can tell it's hard for you even to let go still.
Yeah, I still can't.
And this is why I was telling you that it's good that for him to be in temps for 4 months, because, you know, even if you want to just let go, it's really hard to do that. But you're going to get more and more comfortable letting just, you know, freely just talking, freely just smiling at any moment. And I'm telling you, in a few months when you come back here, your lips will be pulling in a whole different direction. And as good as they may have looked today, I'm sure we're going to have a laundry list of things we want to change. So, I mean, that's normally how it is. And if you don't have the list, she'll take care of me.
Well, they look really good. I like them.
Not too white, right? I think they.
I think they're good.
I think
Yeah.
they're good. They look really nice. They look really nice.
Do you guys have questions at all? Oh, I forgot to ask the question. On a scale of 1 to 10, where are you at as far as pain? You're not even not on the scale?
I think feel a
Zero?
little pressure, but no pain.
Sweet. We'll take it. I thought you were gonna be like a wuss.
No.
Thought for sure. Just kidding.
He'll cry once we get to the doctor.
Yeah, she'll tell us.
No, he said he's actually been really good. Mostly just stuffy, like sinuses. Like he just feels super congested, but that's about it.
Yeah,
Well, cool.
much pain at all.
Well, and so stay with all the advice as far as keeping your head elevated tonight. Stay on the medications every 6 hours. Okay. Really, the 4 a.m. one is the one that's probably the easiest one to sleep through. Just try to set your alarm clock for that. Continue until everything's gone. Like the steroids, eventually should be done with those by probably Sunday or thereabouts. Same thing with the antibiotics. So it's because it's a 10-day course.
Yeah.
And so just finish everything up. You're okay doing the ibuprofen and Tylenol all through up until Sunday. I was actually contacting some pharmacists earlier after, because you started a conversation that like the whole
Sorry.
weekend long. I was calling all my friends. I'm like, hey, I'm trying to tweak some things here. And so I got a pharmacist approved as far as like, could you be on Tylenol and ibuprofen for 7 days straight with those dosages? And they said, yeah, that's no problem. It's when you start to go on, 2, 3, 4 weeks, then it starts to wear on the kidneys. Drink lots of water. That's one of the best things you can do for your kidneys is lots of water, and it'll just make you it'll give more energy. But questions?
He slept sitting up last night. He would even recline a little bit.
Good man.
we kept ice on it all night,
That's
and
good.
yeah, but he did really good. He's been really good with ice. And does he have to ice all day or just?
Whenever you can. So if you're awake and able, ice. You don't. I mean, it's not going to help. It has no effect on healing. It'll just help keep the swelling down, which ultimately comes down to pain. Once the swelling comes in, it's hard to get rid of.
And the
For a
Sudafed,
couple
how
more
long?
days.
Oh, sorry.
Yeah, take the Sudafed just this week. So by Sunday, you don't have to take it anymore after that.
He did take one today because he was super congested this afternoon, but that was it.
First thing you do is blow your nose. Blow your nose. I know you want to, but hang tight. Just even if you have to use a little bit of Afrin, Afrin can help. Don't get too crazy with it because your body gets dependent on it. It sucks, but yeah, just just take all the medications. We'll have the phone on. I mean, we still have the rest of this week, but call us if you have any questions. The biggest mistake I think people make is they let up on the medication, and then pain comes in, and they have to kind of fight it off with some narcotics. So the big difference between these teeth and your final teeth are basically these are a material that isn't very cleansable. It's monolithic in a sense that it doesn't have as much different shades in it. So it's going to look a ton better. If you like the way this looks, the next set's going to look so much better because we can put some blues in it, some grays, to really make it pop and make it look just perfect. The gums will look even more natural. As far as hygiene and cleaning underneath this, it's okay, but the final is like glass. It's like you just don't get food caught under it. And so keep up the good work. You're going to use the water syringe over the next 2 weeks. The water syringe we gave you in that baggie.
Yeah.
That's how you clean it out after eating and drinking. After that, and then you're going to transition to a water pick. And you start off with the low setting. I actually just bought my water pick from finally got it, one thing put in the shower.
Well, we don't have one that goes in the shower, but we've got one made. We made sure we had it set up and ready to go before we.
Awesome.
Tell them about the correct screen to kind of back off of that in a couple weeks.
Yeah. So if you're for the first couple of weeks, use the rinse. After that, you can transition to warm salt water. Okay, because a lot of times it will actually start to stain. We're noticing with these teeth, with a lot of patients, it actually causes a little bit of a staining. I mean, not staining. It's like it's just like I mean, we can get it off, but you can't get it off, and so more for our benefit, don't. We had to bring a patient in just to clean it all off. It was crazy. Other questions?
I don't think so.
Brush them.
You're fine to brush, no problem. Just don't get around the tissue right now. Avoid anything that has nuts, seeds, things like that can get up underneath the device and it's hard to get to. So you'll notice the back, you'll be able to look at them real closely. It's like two flat pieces together. I do that on purpose to help protect you. I did it actually more so on him than I have ever have because I really don't want to take your teeth out. I know that you guys mentioned that you were willing to, but I really took away so there's no places that you can really tear with, and so it's just like two blocks together. So they'll just, but I think it's the best thing just to heal in, and then once we get past that 4 months, we'll come in and we'll put some serious, some rugged teeth in, lots of valleys, lots of mountains, and you could be able to do some damage at any steakhouse. So, alrighty, we appreciate your trust in us, and it takes a lot to do what you guys did, and so we'll see you back just for a bite check in the next 3 to 4 weeks. If the bite feels so good, it looked really good right now, but if it looks great, you don't have to come all the way up for that. Like only if, so we'll make the appointment, and then they'll reach out to you 1 week before and say, do you want to keep it? I would be surprised that you're going to say, yeah, I'll still come in. Most people, because the way I did the bite right now, it's really protected. So, okay. Other than that, I highly recommend, if you guys haven't done this, to set your appointments.
Oh yeah, we were gonna do that today.
Perfect. Set all those appointments up so that we have them all locked in so we can get you guys through this as quickly as possible. Okay. But I appreciate you. You guys are awesome. I know you're in good hands.
I am.
She's a good woman. Thank you so much. Appreciate it. Okay. Alrighty.